In this video, I'm going to expose the 5 biggest lies that insurance people tell about traditional health insurance. It seems like everyone has had big problems with health insurance in the past, and health insurance premiums are painfully expensive. But is health insurance really all it's cracked up to be? Before you sign up for health insurance during open enrollment this year, it's really important to know the facts from the hype. Hi, my name is Art Getz with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about health, healthcare, and health benefits that can make your life better. So big lie number 1 is that health insurance companies always pay the lowest prices for healthcare. I know it's hard to believe that this is a lie, but it's just not true. And with ever increasing transparency in healthcare pricing, the real secret is as clear as glass. In truth, many times the insurance companies are actually paying top dollar for healthcare. Now you might be asking, how can that be, and why would they do that? Well, it's easy to explain. You see, health insurance companies are paying more for health care, and they simply pass it on to the customers in the form of higher premiums. Because that, my friends, is exactly how health insurance companies make more money. This can really hurt when a patient uses high deductible health insurance to pay for health care that might have otherwise been cheaper just paying with cash or credit. This is all too common with things like diagnostics, labs, scans, and images, where the cash price can easily be 60 to 80% less than the price that the insurance company pays. That's because cash is king, even in healthcare. So instead of paying $350, you end up paying $2,000 for the exact same CT scan, just because you have high deductible health insurance. So now you know. Always ask for the cash price for your healthcare, especially before you've met your deductible. Knowing this can help you save a ton of money unless you get caught by the big lie number 2, that it's always best to use your health insurance when you pay for any health care, because the faster you reach that deductible, the sooner the health insurance will kick in. Well, you've probably heard the expression, "I'll scratch your back if you scratch mine." Well, that's exactly how it works with hospitals and doctors and insurance companies. They're all in it to make money. And when you stop and think about it, all 3 gain when patients pay more for their healthcare needs. It's almost like price fixing. And us customers, we end up holding the short end of the stick every single time. You see, your health insurance company has a side agreement with certain providers and hospitals. They call it a network, like it's something special. Wink, wink. It works like this. They say, hey, we'll direct all our insurance customers to you for care, only if we can pre-agree on the price that they're going to have to pay. Then, whenever a new patient shows the insurance card, you get to collect a copay and send out a bill for the rest. Then the patient gets tagged with the full deductible before the insurance kicks in. What a racket. So you might think, okay, I'll just pay the lower cash price and then submit the receipt to the health insurance company as a part of my deductible. Well, not so fast, because the health providers are actually prohibited from offering cash prices to any patient who presents an insurance card. It's all pretty sneaky if you ask me, and it's not what most people expect from their health insurance company. But once you know how the system works, you can use this to your advantage. So here's the secret. Before you show your insurance card, always present yourself as a cash-paying patient first. There's no shame in asking for the cash price, just like you do with every other purchase you make. I mean, can you imagine if you had to guess the prices at the grocery store, and then you only found out the total for your grocery basket 3 or 4 weeks after eating all the food? Getting a cash price is the only way to know if it's going to be better to pay cash or use the insurance. Now, of course, if you've already met your deductible for the year, then of course, by all means, use the insurance. But if you're just getting an initial diagnosis, then paying cash could end up saving you thousands of dollars. Now, there's 3 more big lies being told about health insurance that I'm going to share with you in just a minute. But you just need to understand that these huge health insurance companies are in business to make a profit on the sickness of others. On the Health Benefits Network, we have a lot of videos on the concerns that people have with traditional health insurance that you should know about before open enrollment. We also talk a lot about better alternatives to healthcare and health insurance for healthy people, which is why we're such big fans of medical cost sharing. So if you're sick of traditional health insurance, check out our video called A Real Personal Experience with Medical Cost Sharing. It's about why medical cost sharing is a better deal than traditional health insurance. Click on the link at the end of the description below to learn more. Or just post your questions and we'll get back to you with an answer. So the third big lie is hidden underneath the shell game that traditional health insurance companies make you play. The one called a PPO is always better than an HMO. Things like PPO and HMO are really old tools that were designed to create scarcity and steer patients to certain providers and ultimately charge them more money to access specific doctors and certain healthcare providers and systems. The truth is that these days, every specialist, surgeon, and physician is aligned at least with one healthcare system or hospital in the area. So if you have a particular doctor in mind, it only takes just a little bit of homework when deciding which health insurance is going to be best for you to sign up for. Once you know which insurance your doctor accepts, you can simply choose the health insurance that's accepted by that hospital or doctor that you like best. That is, if you really need health insurance and network restrictions at all. Big lie number 4, health insurance companies are better at picking doctors than you. In other words, the doctors in their network. We all know how to do our homework and pick doctors based upon recommendations from people and sources that we trust. But beware, if you choose a doctor that's not in the network, your health insurance company is going to make you pay extra for that. Like if you have an out-of-network specialist that comes to see you at an in-network hospital, you get penalized. Lots of people have been surprised by this experience. And if you have a story, share what happened to you in the comments below. I'd like to know. Network restrictions are for the health insurance company's financial benefit. They're no guarantee of the best doctors or healthcare providers. Now, big lie number 5 is that health insurance companies will always pay for any healthcare that your doctor recommends. This is a persistent and potentially expensive rumor that's been floating around health insurance for a long time. But anyone that has ever entered into an episode of higher level care can tell you that there are times when your insurance company will not authorize payment for certain types of expensive treatments. This can be especially devastating when your doctor is recommending something expensive and you have no way to pay. Another example of this is where a patient chooses to go to an emergency room, they pay the insurance copay, they leave the emergency room thinking all the bills are paid, and then just when life is getting back to normal, bam, there it is in the mailbox. They get a notice. The ER claim has been denied and they owe the full amount. The insurance company says it wasn't an emergency. And while it darn sure seemed like an emergency at the time, you get stuck with the bills. This is in fact one of the leading causes of personal bankruptcy in America. To learn more about what to watch out for in the ER, check out our video called 4 ER Truths That You Need to Know Before Visiting the Emergency Room. It's sad that nightmares like this happen every day for people who simply don't know that their health insurance does not always pay for the health care that they need. Now, we want to hear from you, so please leave your comments and thoughts in the section below. To make sure that you enjoy more videos like this, subscribe to the channel, click on that notification bell, and we'll be bringing you more healthcare benefit news and stories like this. And don't forget to hit that like button and share this video with your colleagues and friends because they have a health insurance problem too.